ये स्लाइड शो लगा दो, नहीं हो रहा है। ये see, most important thing. Hello, good evening, everyone. This is MK Sastry again, and we are at the live telecast of the class. So, most important part before we go for anything in principal, meridian, and all, we must understand what are the possible things which we have to take care while doing acupuncturing needle. What are the things we have to take? One is preparation, what to be prepared, precautions, possible accidents, and their management. What are the wrongs which will happen during the treatment and how to manage them? This is the principal thing one should understand while treating a patient. What are the things we need to understand? What are the preparations we require to treat a patient, precautions, possible accident, and management. So if you do all these things, we'll be very careful, will be safer side, patient will have safer treatment, quick recovery, faster results, no accident. And that is the goal of this class. So what will you understand? What are the things we need to do? See, first is the preparation period to the acupuncture treatment. What are the things we have to prepare ourselves? What are the things we require? The first thing is that inspection of your own devices. What are the things you are going to use? Cotton, moksha cones, how to extinguish them, rolls, solutions, cottons, and one is forceps. What other thing you need is forceps. What do you mean by forceps? By chance, if the needle is broken, what will you do? You take one sketch pen, you mark that area, use a forceps and pull down the needle. So 6 things you require in your table before treating a patient. What are the things you require? Cotton, spirit, forceps, color pen, and moksha roll and extinguisher. 5 things you require. So you have to inspect everything is on the line. What you need to do is that you need to take one sand in some extinguisher and you have to put the moksha roll inside. Otherwise, there will be whole smoke in the room. Better to always try to use dry moksha, smokeless moksha. But if you don't have smokeless moksha, then you should treat the patient near a ventilation area so that the smoke does not destroy the. Am I clear? Raise your thumb. Raise your thumb, everyone. If I am clear, please raise your thumb. Ishwar, Prakash, am I clear? Raise your thumb. Abdul, am I clear? Raise your thumb. Abdul Jakir, Jalil. Abdul, can you hear me? Abdul, can you hear me? Abdul Jalil. Abdul, can you hear me? Mute karo. Ishwar, can you hear me? Sonali, can you hear me?
Yeah.
Sonali, I'm talking to you. Can you hear me?
Can you hear me?
Huh? Sonali, can you hear me?
Enggak.
So what should be the second thing? Posture of the patient. And any appropriate posture is important for the patient. What is the appropriate posture? Correct leg question. First, you have to diagnose the patient. See, what is the posture in the position in which you are going to treat the patient. The first thing you have to do is the posture of the patient. What should be the posture? You have to determine that. First is inspection of your instruments. Second is the posture of the patient. Right? In posture of the patient, you must identify the disease and then put marks on your point. As per the points which you are required to treat, then you have to decide you want to do moksha or needling. So in how many minutes you are going to retain the needles and then prevention of possible accidents. So generally what we do, we make the patient sleep on the bed in a prone position or in the opposite direction. Why? Because during needling, the patient may go to vasovedical syncope. What is vasovedical syncope? Vasovedical syncope means, Abdul Jalil, can you hear me? Abdul?
Yes, sir.
Can you hear me?
Yes, sir.
Fine. So during this period, patient has a sweating on the, after putting the needles, patient has a sweating, vertigo means the, like this, and suddenly the patient goes to the sinking level, like this, like this. So you may not need to be afraid, just press this point over here and leave it for 20 minutes. So if you do this, the patient recovers nicely and the attack lasts for 25 minutes. After 2 minutes, the patient will open the eyes like this if you press it very tightly, like this. So the patient will open the eyes. Then I ask the patient to move the eyelid, first, second, third, fourth. Then allow the patient to take rest for 20 minutes. After 20 minutes, help him to support and drink the water. During this period, the patient will do some vomiting. So don't worry about the vomiting. Keep a dustbin with a polythene and let the patient vomit. And explain the patient that block has been opened. During the opening of the block, these symptoms come, and it is very good for the patient that these symptoms have been recovered. And let us be happy that this is not an accident. It is because of the fear of the patient is suffering from vasovedical syncope. Right? So most important is why you should make the patient lie down like this, because he may get vasovedical syncope. In this, the patient has a sweating and vertigo. Now what, second thing is which size of the needle is required. See, generally 3 or 4 sizes of the needle which we use. One is 0.25 mm into 25 mm, then or 0.30 mm into 25 mm, and it is a size is 1 inches, 2 inches, 1.5 inch, 3 inch, 4 inch, and 6 inch. So you have to decide before the treatment what are the points you are going to use, the depth of the points, and the retention means to how long the needle has to be inside the patient. So 4 things. First thing is inspection of the instruments. Second thing is after the treatment where to dispose the needle, what is required, and third is which type of needles you need to select for the treatment. Am I clear? First thing is what is required, you have to inspect it. Second is the posture of the patient. Third is the size of the needle. So size of the needle will depend on the condition of the illness and the existence of the illness, and then the requirement of the disease, and then the selection of the points, depth of the points, and retention of the needles with time of needling. So 4 or 5 things are required, and this is among this. See, these needles generally are sterilized needles. We don't need any autoclave for this needles, because if you use autoclave, since the size of the diameter of the needle is very thin, the needle becomes very difficult to be used. So no need to go for what you call autoclave sterilization. Autoclave means a sterilization unit. First of all, the autoclave sterilization costs you around 50,000 rupees. Secondly, this needles is always better to reuse and throw. Never reuse the needles, because if there are any chances of infection, then you may be in trouble. Both the patient and your life is in trouble. So it is always better, instead of sterilizing that needle in the autoclave, it is better you use and throw. So boiling that needle for 30 minutes means the chances of accident becomes high, because this needle does not get pierced inside. So better to avoid one safe direction, never to reuse the needle. Use and throw. Best thing. Don't try to save so much money. Always try to be more cautious in medical practice. So best thing is that instead of using autoclave, put the needle and destroy it. So generally you will get one spirit in the market which is having 25% alcohol, 2% tincture, and so generally we used to use the cotton like this and we rub on the body like this. Yes, so that all the dirt and dust is removed from the skin. So things what you need to understand is section of the material, what you are going to use, posture of the patient, size of the needle, and the needles which you use to the sterilized one, and the sterilization of the skin is most important. Am I clear? Now what you should do, you should never do acupuncture on a hungry person or who is exhausted, because at that time if you do, the chances of sinking the patient becomes high. So never treat a patient if he is hungry or overeaten. Am I clear? Or hungry, overeaten, or fatigue, means tired. So never treat a patient if he is tired, overeaten, fatigue, or alcoholic. Four things for understanding the treatment is that it should not be treated on a hungry person, overeaten person, drunken, and fatigue. If you in most many cases, acupuncture points are contradicted. That means in pregnancy, if you use Li4, K6, K3, SP6, these are contradictory points. They may go to every level. It may kill the fetus. So never use acupuncture on a pregnancy case, because you do not know which points are to be used and which are not to be used. So we say that it is contraindicated for pregnancy cases, because you should be specially trained in treating a pregnant lady. So next time when you see a patient coming with pregnancy, try to avoid this, because if you meet up some accident, you will be guilty for your whole life, and your confidence of treating a patient will go down. So never treat a pregnant lady. Generally, this point I treat a lady in menstruation period using certain points as per the condition of the patient. By adding certain points, you may treat a patient. Otherwise, in menstruation period for 3 days, you should not treat a patient. It is general advice. But if he is an expert, he may treat the patient. Otherwise, it is advised is do not treat a patient if he is under menstruation. See, in using an infant patient, you should use the laser stimulator. This case, laser pen has come. I will advise don't use needles on a small kids at this level. I generally use it in small kids. I insert the needle directly on the forehead and all. But until unless you are practically trained, do not do this practice. So, in case small kids, do not try to retain the needles. Do not use laser pen. This laser stimulator is very good for treating CP child and many cases of small children, which we have successfully done in large number of patients. See, I already told you vasovagal syncope. You call it acupuncture syncope or vasovagal syncope. Struck needle. Generally, when the needle is stuck, it is inserted and it is stuck. Sometimes you pull out, it does not come. So what you need to do, there are two things. First, just move the skin like this, right? And then move it like this with the two fingers. Just manipulate it, take it deeper inside and take it very closely. And if does not come, with this method pulling up does not come, then put another needle to that area, because the small spasm has recorded to that area. So what to do? When the needle is inserted here, take another needle here. Put adjacent to it, 2-3 needles adjacent to it, and the needle will come out. Two methods are generally used. Just rub the skin like this and closely move the needle like this, and then take it out lightly. Do not push it out. And by chance, while pushing out or pulling out, pushing out means just forcefully. Do not take out the needle forcefully in a pitch. Very politely. You have to be polite with the needle. Just manipulate it It will come out. Number one. Number two, rub the skin like this, to and fro nearby skin, and then take it out lightly. Number three, put some needles near to that area so that the spasm goes down, and you take out the needles beautifully. Number three. And so, if the needle is broken inside, you have to be very careful. What you need to do is, you have to draw that area, and if the needle goes deeper inside, you need not to worry too much. Generally, body does not resist any foreign body inside. So it will push it out by making some infection to that area. Number one. Number two, you may refer it to a general surgeon, and you have to pay around 15 to 20,000 rupees fees. You have to tell him this is the area. They will put one C-arm, and by putting a C-arm, they will exactly locate where is the needle, and then they will cut it down, and they will take out the needle, and the patient may just be discharged after 1 hour of the surgery. One is hematoma. Hematoma is called the bleeding. And the most ideal thing is that if the bleeding is high, there is a swelling in that area. So you need to just press it down and the swelling goes down. Take a cotton and press it like this. So when you bleed it, take out, put up needles inside the eyes, remove the needle like this and put some cotton for 1 hour, for 40 to 50 seconds. There will be no hematoma. So when the patient is having faint, that is vasovagal syncope or acupuncture syncope, what do you see? You see weakness or tiredness of patient, nervous and tension, hunger, profuse sweating. Lot of sweating will be there in this patient. Improper posture in acupuncture treatment and excessive manipulation during the acupuncture treatment. See, generally you see that if you manipulate too much, then also you may go to acupuncture syncope because of fear also, because of improper posture also, because of hungerness also. There may be various reasons why patient may go to vasovagal syncope. During that period, allow the patient to take rest and remove all the needles. Allow the patient to take rest for 25 minutes. Immediately use this point near the there are 3-point zone, 1, 2, 3, and 1 is 4. So 1, 2, 3, just in this area. So first use just below the nose, then this, then this. So if you use three points, immediately the eyes will open, and then you should be careful. Always explain the patient that attendant before starting the treatment that the patient, when the blocks are open, patient may go unconscious or may, because of the fear, they may go unconscious, but after 20 minutes, if the blocks are open, they will be okay like before, and you need not to be afraid of anything. Sweating and all this will come, and this is good for the recovery of the patient. If you say him positively, and before the treatment, if you say all these things, patient is happy, you are happy, and it's a successful treatment procedure. So what should be the management? Stop needling and withdraw all the needles immediately. Lie the patient in a spine position like this. Savasana. So make the position like in spine position. Elevate the legs, loosen the tight clothes, and keep the patient warm. So during the patient, lot of shivering is there in the body. So always use a blanket to use the patient warm. For light cases, severe, make the patient warm, give him some hot water, glucose, and after a short while, the patient will recover after 10-20. For severe cases, use emergency acupuncture point. I told you GV28, PC6, LI4, liver 3, LI1, and ST1. Only in emergency cases. Otherwise, GV26 is more than enough. This GV26 is more than enough. PC6 and GV26, the combination of two is more than enough to recover the situation. But during this attack, patient takes 20 minutes to recover the area. You may also use GV20. It is Bahui, this one. So just center of the head. Take this side, take the middle finger, and this one is the point. Like this. Measure it like this from end of the head of this area, starting of this palm should be over here. And then from the middle finger, you see the center of the head. This is GU20. So you may use Moksha, you may use pressure, you may use the laser pen. So if you use GV laser pen or Moksha on GV20, it's in extreme cases. Otherwise, this is enough.